Watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. We're talking about the term is called full mouth reconstruction. According to my first guest, your teeth are never too far gone to have the smile that you've always wanted. With us, we have an expert on the topic, Dr. Jay Goel. Dr. Goel, welcome to the program.
Thank you, Randy. Thank you for having me.
Now, before we get into today's topic, and I know you brought a lot of photos, so we'll get to as many of those as possible, but give us a working definition. Like, what is full mouth reconstruction mean? I guess this is dental talk.
Yes. Full mouth reconstruction is a varied topic, Randy. I mean, I don't know where to start.
Okay.
It can start anywhere from a single crown or a bridge to a complete smile makeover for somebody that just changes their lives completely. You know, it gives them a whole new lease on life, and tears well up, and they're just so happy to see. It can include simple, single implants or a full mouth of implants if need be.
Okay.
So
now, your practice, and I know it's not a recognized specialty, but I think some of the terms that they use, like super specialists, I mean, you do a lot of things.
Yes.
So tell us the different things you do in your practice.
Oh, we do everything. We from A to Z. We cover simple implants, crowns, root canals, orthodontia, braces, Invisalign clear aligners, to periodontal gum therapy, including lasers, Botox. People, that's the latest and greatest. Periodontal surgery, gum lift, the pinhole. That's becoming very, very popular these days. Called the lunchtime gum lift.
For gum recession.
For receding gums. Yes, absolutely.
So you have this new concept that's going on in certain practices where everything's done in one place.
Absolutely.
Or
yes.
normally you might go to a specialist for this or a specialist for that. You do it all right there.
We do it all under one roof, everything under one roof. And the reason for that was because, a lot of my patients would complain, they would go from one office to the other. They're just shipping, it's like farming it out, they get tired. These are working people, right?
Because nobody likes going to the dentist anyway.
Nobody likes going to the dentist, and they're taking off of work and they're going to one office, then they're going to another office. It's like, where does this end? When do I actually live my life? And they get tired of that. And, I wanted to help my patients, and I said, you got to give them a one-stop shop solution to get the work that they need done in a timely manner so they can live their lives. Teeth are one aspect of their life, so we want to help them live the life of their dreams.
Now, you're a dentist, so it does not surprise me to hear that you think that the teeth are the most important thing. How important is a smile, in your opinion?
Yes, I guess you would say that as a dentist, but if for a dentist, yes, a smile is important. But for a normal person, for average Joe, average Jane, it's so important to be able to live the life the way you want to be able to date the person that you like, to be able to go on a date with them to a restaurant, to be able to eat anything you want from the menu and not be held behind. You're at a party, you're hiding behind your smile because you're afraid to kind of put your best foot forward.
Are there a lot of people ashamed of their smile? I mean, you hear these stories, obviously.
I hear these. Oh my God. I mean, they probably won't tell you, but when they come in, they're like, Doc, when you go to a party, you see the guy or the girl across the room, and they're smiling and they're happy, and they're
the charisma.
The charisma is just, it's amazing. It's like, it's magnetic.
Yeah.
And then you see this one person at the corner of the room, they're afraid to talk to someone. You feel like they're having a bad day, or they're mad, they're upset, they're angry. But it's just because they're afraid to smile, and it kind of just covers everything else about their persona.
Can you spot it as a dentist? Like, you could tell who's hiding their smile?
Now I can.
Okay.
Yes, it's fairly easy now because that's holding them back. It's just one small thing, but it makes such a big difference in their whole career, in their whole personal and professional lives. So you asked me how important the smile is. In just about every survey that's done, look at Gallup, look at Elle magazine, look at Cosmopolitan. The smile is the first thing people notice, in their potential mate, and or it's in the top 3. So
yeah, when surveyed, that's right.
Yeah, absolutely. So it's important. Take Hollywood, for example. If you want to make somebody look poor, what do? You take away a couple of their teeth.
That's a good point. Like in a movie, you want to make somebody look like a street person and mess up their teeth.
You darken up their teeth. You make them you give them buck teeth. And all of a sudden people start judging that person. They think they're from a poor background, or they're not as educated. So it kind of sets. People start judging you just based on your smile. If you had a job interview, if you have 2 sisters coming in, right? And one is smiling and chatty, and she seems well adjusted, she's happy, she's outgoing, she's interacting with you, and the other sister is kind of bashful, she's very stoic, she's not smiling, who do you hire? You know, it's a very,
Well,
very
the one
easy.
that looks confident,
exactly.
right?
The one who's well adjusted, the one who's social. You know, we call it the social six. You know, you got
The
to smile.
social six.
Social six.
Because you're showing like 6
Because you're
teeth or
showing
more.
6 teeth. You know, it's like you want to put your best foot forward. So it's extremely important, not because I'm a dentist, but I think it's important because people want to be themselves. People want to show who they really are and not hide behind a facade because they're being held behind. You know, there's a good quote I recently heard. It says, "Everything that you ever want is on the other side of fear." You know, people are afraid to go to the dentist. You know, but if you just come in for regular dentistry and kind of get on the right path, you know, it just changes your life. Simple things. Let me tell you what I've witnessed in my own practice when we've changed somebody's smile. These people have just avoided going to the dentist for many years. You know, they're kind of out of the cycle. They're out of the network, I guess, and they're just not coming in for their regular checkups and cleanings. And then they start to avoid. They kind of neglect comes in, you know, and when they come in and they get their workup done. And at the end, when you finally see the transformation, it's so liberating for them. I mean, I saw this one gentleman. He came in and he had no back teeth. You know, he wouldn't go out to dinner with his wife. You know, his grandkids. He would just avoid meeting people. You know, because people would, you know, as you get older, people want to go to dinner. They meet their grandkids, and people bring them food.
Okay.
You know? And they start hesitating because they're afraid. What are they going to eat? Let me tell you about this guy. You know, he's a big guy. You know, he looked like a Navy SEAL, literally. Okay. Couple teeth are gone. Some veneers are gone. So he busted a tooth because he likes to fight people, and they do it for fun. You know, he's like one of those MMA artists. You know?
Okay.
I gave him. I think I replaced one tooth, one implant, and I replaced one veneer. I mean, this guy he transformed. Okay, he's happy as can be. You know, he's like a teddy bear. You know, he's flirting with my assistants. He's flirting with the front desk. He's showing me all his photos of his MMA fights now. You know, it's unbelievable.
Just because of his teeth.
Just because of his teeth. Just because of his teeth. Can you believe that? I had this one lady who came in and she was really nice person. Really nice person. Single mom. Okay, working multiple jobs, really held back because of her smile. No back teeth, can't chew, doesn't like to go out with her girlfriends anymore, and just does not living their life. You know, she went to multiple dentists, and you know what they tell her? They tell her she doesn't have enough bone to get implants. I mean, that's their experience. According to their expertise, that's their limitation. She found us out. We you know, with newer guided surgery, with newer cone beam scans, we gave her the smile that she wanted. And now look at her. It's a completely different story. She carries herself differently. Her hair is done. She's always happy when she comes in. She brings us food all the time now. You know, she's so happy because she can eat the food. She can enjoy the meals at the restaurants with her friends, and she's just living the life that she wanted to live, and not having to avoid going out with her friends, not having to avoid going out with her children and her grandkids, and being held back because she couldn't chew. You know, it's unbelievable. It's so liberating to see that.
So with your patients, because you do porcelain veneers, you have a machine, I guess, that makes crowns while they wait, right there.
Absolutely,
so
right
you're
there.
able to do like a veneer, maybe if they're missing one tooth, you can give them a dental implant. So it's all
away.
right there.
It's all right there. It's all right there. Do not have to go anywhere else.
And you're big on sedation.
Yes, we are.
Who gets sedation?
Anybody who wants it. I had this one patient. Let me tell you about this story. In fact, I have photographs as well I'd like to share with you.
Okay.
Very scared.
Let's take a look at the photo.
Very scared.
Oh my goodness.
Does not want to get anything done. And obviously you see that because of the fear, you know, they do not want to come in, and then it just builds up and years of dentistry that has been postponed. Okay, and then they search us out, and they're like, okay, you know, they know that I need this because this is affecting my general health.
So to you, is this like a full mouth reconstruction? You got to kind of rebuild the whole mouth?
You got to rebuild. It's like a whole bevy of procedures that we're going to be doing. You know, it's like, God, where do I start here? It's so much work that needs to be done, so much work that needs to be cleaned up. But once it's done, it's a completely different person. Take a look at this.
Nice. Wow.
Completely different person. Completely different person. It's amazing. It's amazing how happy she is. You know, she's happy to go out with her family now. She's going to restaurants. She's meeting her girlfriends. She got sedated. We have an anesthesiologist right in the office. Don't need to go anywhere else. They come in, they put you to sleep. You wake up and you have a beautiful new smile. No downtime. It's unbelievable. Take a look at this patient, Randy. I mean, very apprehensive, very scared of the dentist. Okay, did not go for years and years, and then she comes in. okay, and we sedate her.
And this is one day? I mean,
This
are
is
you
one
able to
day.
do
This
this
is
in one
all
day?
done in one day, in a few hours.
Okay.
You know, we sedate her. She wakes up and she has a smile back. And look at that smile, Randy. Look at that eyes. You know,
looks
those
happy.
eyes, those eyes tell you that she's happy. You know, she can smile when she wants to. She looks youthful. You know, she's carrying herself so confidently. She can go out and meet the people and greet the people and go to dinner and just live her life. You know, it's unbelievable how liberating that is for her. Okay, and we can all get this done in one day in the office. And let me tell you what would have happened normally in dentistry, Randy. She would have had to go to a different office to get her teeth out.
Like an oral surgeon?
Like an oral surgeon.
Okay.
Then she would have had to go to a periodontist. Then she would have had to go to a prosthodontist. You know, somebody's doing the implants, somebody's doing her crowns and bridges, and then she's coming back and seeing me. I mean, it's just the rigmarole, just the runaround. But now, with our office, it gets done in one visit. And not only
Okay.
that, somebody else would have probably just put her in dentures. I can't believe how sad that would have been. You know, now she's not in dentures. She's got a smile that's hers. It's fixed, doesn't need to come out. And it was all done in one day.
So this is this full mouth reconstruction. Can you ever be too far gone? Like, have you ever met somebody that says, there's nothing we can do?
Very rarely, Randy. That normally doesn't happen. With newer technology, with the newer cone beam scanning, with the newer guided surgery, I'm telling you, if the person can walk, okay, if they can hobble into our office, even if they come in a wheelchair. We just took care of an 89-year-old lady. 89-year-old, she beautiful lady. She was so happy. She's such a kind lady. And she came in and she wanted to have a smile back. A lot of the offices that she's going to, you know, they're dismissing her. They're not listening to her.
Because she's 89.
Because she's 89. Because of her age, they're discounting her. They're like, okay, you're fine. Just get a denture. When I saw her, I knew I could help her. Okay. We took the scans, we did the workup, and now she has a fake smile. Okay. And for her 89th birthday, she got her smile back. You know, she came in all dressed up. She looks gorgeous. I mean, it's so.
So they
beautiful.
change. I mean, you do like a smile makeover,
We
like
do
a
a smile
cosmetic
makeover,
dentistry
like a
on these
cosmetic
people,
smile.
and everything just changes.
Everything just changes. I mean, they're just amazed. They all tell me, you know, Randy, they all tell me, I wish I'd done this 20 years ago. Why did I wait?
But that's the challenge. We all put things off, right?
We all put things
We
off.
wait
Life
and wait.
happens, you know, life happens. Life happens and we get distracted. We're looking after our kids, we're looking after our families and our parents, and we forget to take care of ourselves, you know. And when they come to me, you know, it's my job to take care of them and give them the smile that they've, you know, wanted, but just were not able to focus on.
Now this, okay, so when you're creating a beautiful smile, what percentage would you say it's 50% art, 50% science? Is it more art than science?
It's a balancing
think?
act. I mean, I think it's a combination of both. Dentistry is an art and a science. It's a perfect amalgamation of both, I would say, because there's so much technology that goes in, which is science. But then to create the smile, we can literally, with our newer technology, we can actually sit and design your smile the way you want it. If you want
Like
your
how?
teeth,
What do you mean?
you can actually take it is so amazing to see this thing come to life, because you take we actually use a technology that they use in Disney. You know, they're using the same computers to design the smile if you want your teeth longer, smaller, wider, narrower.
So you just show them on a computer what
Show it
they're
on the
going to
computer,
look like?
What they're going to look like even before we start. It's amazing. Whether you want veneers, you know, whether you've been hiding behind a dark, you know, a lot of people, you know, earlier, I would say maybe 20 years ago, tetracycline was big. You know, a lot of people would get sick and the doctors would give you tetracycline. So you'd see these people, you know, they always look upset. They're not upset. Their teeth are very gray. They're
They
afraid.
just can't smile.
They just can't smile. They're afraid to smile because they're just shy of smiling. And then you tell them, hey, listen, one visit, veneers, and you're done. You got the smile that liberates you, that sets you free, so you can get on with your life and go on those dating sites and go to those restaurants and go on those job interviews and just feel good about yourself, you know. And with the newer technology, you can get the veneer if you feel like your teeth are broad, they're narrower, you know, they're taller, they're not as white. We can give you a custom-made smile in 2 visits.
Interesting. Now you mentioned earlier about teeth in the back. Like if you're just missing 2 teeth in the back, you give them dental implants. But why, if you're only missing a couple of teeth and they're in the back, why fill them in with implants? Help me understand that.
That's a great question, Randy. Thank you for bringing that up. It's so important because our teeth are like, it's like a chain reaction that starts. You lose 1 tooth, right? Nobody's worried about that. It's in the back, it's not visible, I'm okay. That's what most people think. And that's what I hear all the time. It's like, oh, it's fine. it's one tooth, I don't need to worry about it. But then the other teeth start to shift. Our teeth are always shifting. And patients know that. A lot of patients, oh yeah, my teeth
So
shifted.
as you lose a tooth, what? You're
Yeah.
not holding them in place as well?
You're not holding them in place as
Okay.
well. So one tooth shifts, then the top tooth starts to move down. Then you start getting food getting caught everywhere. You go out to dinner, you got spinach caught here, you got a carrot caught here. I mean, it's like you're creating a larder in your mouth to save food for later. No, that's not. That's not
Yeah,
right.
yeah.
You know. So, and then before long, you lose another tooth because you're kind of favoring one side because you can't eat on this side because you lost a tooth on this side. Now all of a sudden you've lost another tooth on this side because you're putting too much pressure here, and then it starts to
So
snowball. on you.
ideally is what?
You just want to replace that tooth right away.
Okay.
You just want to replace that tooth right away. It's kind of like a car. I give some of my patients like an analogy for a car. If you have 4 tires and you lose one tire, you're not gonna be like, hey, listen, I got 3 tires. I'm okay.
Okay.
That car's gonna crash very soon. You know, God gave us 32 teeth.
It'll still drive, but
it'll
not very
still
well.
drive, but not very well. You know, essentially, yes. You know, so you want to try and replace that tooth right away. Now you could replace it in multiple different ways. You could get a partial denture. You could get a bridge. You could get an implant. And with our office, the beauty of it is we all do it under one roof. You know, we have the
Okay.
technology. Believe it or not, we have the technology to get it done in one day. You come in, and if you're missing a tooth, we can replace that tooth same day.
So there is a movement going on across the country, you know, and we've had the show for 20 years, and I interview a lot of medical doctors and dentists, but where there's a group of people that you can't save their teeth. Full mouth of extractions, and then you put implants. But like you say, losing teeth can be expensive. That
It can be.
oftentimes you could save teeth and do a combination of procedures. Elaborate on that.
We actually pride ourselves on that. A lot of these patients, there's a big movement coming around that everybody's just pulling everybody's teeth and just giving them full sets. Okay, we feel like it's expensive to lose all your teeth right away. Okay, there's a sense of loss that goes with it. Can you imagine
that
losing?
right?
Can you imagine losing all your teeth? You know,
Yeah,
all your
that's
teeth.
interesting.
That's a little scary to me. So I feel like I can help these patients. And my goal in our practice is if these patients come in and their teeth are salvageable, we will move heaven and earth to make sure that we can
save those teeth.
It's important. They're your own teeth. Okay, they're worth keeping. So we try to do whatever we can in our part to try and help the patients affordably keep their own teeth.
Now, what if they have really bad gums?
It's treatable.
Can they still do
can still
things
do them.
like
Yes, absolutely.
veneers and implants and
My father, he's a dentist,
Okay.
and he once told me, you know, every case is manageable. You gotta find out what needs to be done. If the gums are bad, we treat the gums first because they're the foundation of the. Think of a house with stilts. You got to build the foundation right. If the foundation's strong, then the teeth are going to be strong. So the gums and bone are the foundation. We make sure that the gums are healthy and clean, and then we will focus on the teeth. Can they get veneers? In many cases, you'd be surprised, Randy. We've had some beautiful results.
so you
with
can go from really horrible, they say, I have bad gums, I got this, to brand new teeth.
brand new teeth, brand
With
new smile.
veneers, maybe
With
single
veneers.
tooth implant here and there.
Here and there, yeah, whatever's needed. We kind of plan the case out. Maybe they can't keep some of their teeth. They don't need to lose all of them.
Okay.
So if we can save majority of their teeth and give them the smile that they want, it's still a win-win. You know, they still keep their own teeth. They have the smile with the veneers or the crowns or the implants, whatever is necessary. And we can still work at getting them the fixed teeth that they're looking for. You know?
Okay.
So whatever the solution, every patient, it's like a custom solution made for all patients that are coming in. You know, and we are experts at designing it. We've got years of experience behind us, and we can get it all done in our office without a lot of downtime.
Okay, good. You have more photos.
I do.
What else
I
are we
do.
looking at?
We have a ton of photographs here. So let's take a look at Erica here. Take a look at her. She's works in the legal profession.
Oh, boy.
Very, very nice young lady. Very outgoing. Amazing personality, but held back by her smile. This young lady here is a very, very attractive person. I mean, that picture does not do justice.
Okay,
to her,
yeah, I don't think so, right. It's not so good.
Take a look at this one.
wow.
I mean, she's Julia Roberts.
Yeah.
You know, you know, and I mean the result that we've gotten, she is so confident. You know, she's involved in meetings all day long. You know, she's at a very high position in her company. She's meeting with the hoity-toity of society. You know, she's out networking with people all the time, and I can't tell you what a difference that has made in her
So how do
career.
people even find out about you?
We try to connect with our patient in a variety of ways. We send them a flyer every month to kind of tell them about our office, the services we provide.
Okay.
We're on Facebook, we're on Instagram. We have a dedicated team that's kind of giving the patients information inside our offices about the services we provide. We have the most reviews of anyone in our area. We are the most high-rated office on Google.
How many?
650, I think.
Is that right?
That is
So
correct.
people like you guys.
People like us.
So no matter how bad your smile is,
No matter how bad your
you
smile
can take care of it.
We can take
And you
care
call
of
it full mouth reconstruction, or at least
mouth
that's what
re-
we're talking about today.
full mouth reconstruction.
So what else do you have? What other photos?
Take a look. This is an amazing story. I'm going to tell you a story about two lovebirds, high school sweethearts.
Okay, this is good already.
Joanne came to us.
Okay, let's take a look.
Take a look at her. She's got a wonderful lady. Again, same thing. You can take a look at her smile. She's got a lot of wear on her teeth. Okay, she's got some gaps there. Okay, that may or may not have bothered her, but now she's missing a lot of her back teeth, and she's just not able to eat what she wants. She loves carrots and celery and cucumbers, by the way. Okay, and she was just not able to function. No back teeth. Okay, and then look at her smile afterwards.
Nice.
She can't stop smiling anymore. I mean, she's just bubbly and chirpy, and she can't thank us enough after this. She was so happy with the service that we gave her, and she was so impressed that she referred her husband, her high school sweetheart, to us.
Okay, she drug him in.
She drug him in. She did.
Is that common? A lot of wives have to, because men put everything off. I mean, do they have to bring their husbands in?
Husbands are tough, They're tough guys. I mean, if you look at John, John is a man's man. He's strong. He's tough.
This is his new teeth right here?
This is his new teeth right there. He would not want to come in unless there was a problem, and he was missing his back teeth as well. But he wasn't concerned about it. He's a guy. He's not doesn't hurt. Don't fix it.
So when you give them those back teeth back, let's say with implants, do they notice the chewing is like?
Oh my
is that
God.
what they notice the most?
New lease on life. You can eat steak. You can eat carrots. You can eat
Okay.
salads, nuts. People. I love nuts. I'm nuts
Okay.
about nuts. I mean, you got to, you got to be able to enjoy the diet that you want. I mean, if they have grandkids and if the kids are coming in and they're like, "Grandpa, I got an apple for you here. Let's have it together." And now he's not afraid to bite into that apple without worrying about his teeth falling out. Isn't that liberating? Now there are lovebirds. Instead of
Call
worrying
them lovebirds. Okay.
Yes, they are lovebirds, and instead of worrying about their teeth and what they're gonna, how they're gonna eat and where they're gonna eat and what they're gonna eat, they're planning their next vacation, where they're gonna go, how they're gonna get there. Life has moved beyond worrying about their teeth now, because their teeth are in great shape, so they can live their lives like normal people. Let me show you. Can I show you a couple more photographs?
We got time for a couple
These
more.
These are our I like to call them my models, because take a look at this photograph.
All
here.
right.
Amy's very, very high up in the retail industry, and again, same thing. She's been wanting to show off her smile. She never smiled. If you look at all her photos,
Is that what she told you?
exactly. We have pictures after pictures of her, and she would never show her teeth. This is her after I finished her veneers.
Nice.
She can't stop smiling now. She can't stop smiling. Every picture we take of her now, she's showing off her teeth. She can't stop showing
Now
off
they're
her
probably
teeth.
doing selfies on Facebook,
Absolutely. Instagram, they're all over the place.
irritating their friends with all their
Irritating
selfies.
their friends and family with all their selfies. Absolutely. This is another one.
Okay.
Another one. Sarah, if you take a look at her, she was concerned. She had a lot of. This is an interesting case. A lot of enamel wear. What I've found is a lot of people are into the soda beverages. Like the Monster drinks and some of our carbonated beverages like Perrier and all of that stuff.
Yeah.
It's unbelievable that you would think that even though they're not as sugar heavy as we would think, but they still do a lot of
acidic.
erosion. Yes,
Okay.
acidic to our enamel. But
So when we look close at this before,
yes.
so those can't treat with whitening.
These can be treated with whitening. In fact, they get very sensitive, so we treat them with veneers. And the way we do veneers is really good, because we're not grinding your teeth down. We just do a little bit of small adjusting your tooth here and there wherever it's necessary. This gentle buffing, and then you put the veneers on in one day and take a look at the result.
Take a look. Very nice.
Take a look at the result.
That's nice.
Isn't that a beautiful smile? I mean, look at the eyes, look at the smile, look at the lip line, look at the youthfulness of the smile. It is just unbelievable how great she looks. And that's given her, she knows that she looks good, and she just steps out like a model. I mean, it's wonderful. It's wonderful to see them so confident. I got one more, just the last one. Take a look at Brian.
Okay. What's going on here?
Full
This
mouth
is-
reconstruction
this looks pretty
here.
bad.
He's same thing. He's got a lot of dentistry there. That's years of dentistry, and then he just got tired. Did not want to go back again. And then finally he was lucky. He found us.
So this is a full mouth reconstruction.
This is a full mouth reconstruction case.
Nice.
He's not worried about what he's eating anymore, what he can and cannot chew. He's not looking at the menu and thinking, oh my God, what am I not going to be able to order? A lot of these people, Randy, their partners have good teeth, but they don't. They're sore, they're hurting. They can't go out with their partners on a dinner date and eat what they want. They're limited.
Okay.
So once we're done bringing their teeth back to life here, they can, they turn expensive because now they can eat what they want. They can smile, they can go out, they can meet friends. They start
So it's
spending.
expensive because they're eating out more.
They're eating out more. They're buying, they're meeting people, they're going shopping because they feel like they're a different person.
Okay, good. So this new thing, so we're calling it full mouth reconstruction.
Yes, we are.
But the public doesn't know. I mean, how do you find a general dentist that has been trained in all of these, in the surgical, in, as you guys say, the restorative? I mean, you have a lab right there on site. What do you ask? Do you do everything right there?
Yes, we do. I mean,
What do you think a patient should ask? What should they look for in a dentist that's going to do a full mouth reconstruction?
I think the patient needs to do their research and make sure that it's a reputable dentist that has a lot of reviews like we do. They want to look and find out that they want to ask the right questions. Are you able to provide these services under one roof? Are you able to give me some samples, like photographs that we've done of work in the past that happy patients that have had the result that they're looking to get? Do you have the lab on premises? Do you have the technology? Can you show me a result of what I'll look like before you even start? And we are able to provide all of that. Do you have the specialists in the office? Yes, we do. We like to think that we're the best in the business in the greater Philadelphia area.
Good for you. Good,
Thank
good. So final message, somebody watching this, they don't like their smile, right? But for whatever reason, and maybe they've heard what you had to say today, but they're hesitant. They're putting it off. What do you say?
I would say to them that if there's something about yourself that's bothering you, that's holding you back in life, you can change it. If you don't like your nose, you get your nose corrected. If you don't like your weight, you start working out, you start eating right, Same thing with your smile. The smile does not have to hold you back anymore. Okay. You can correct your smile quickly, safely, if you want to be sedated, painlessly, and it can all be done in one day if you like at Media Dental Associates.
All right.
And our number's right there on the screen. Give us a call. We'd be happy. We're giving away free consults.
Okay.
And we'd love to have you come on and check us out.
And ask for Dr. J.
And ask for Dr. J. Absolutely.
All right, Dr. J, I want to thank you for coming to the show. Great stuff.
Thank you for having me,
And these
Randy.
pictures are on your website and things like
are,
that. A lot of
yes.
stuff on your website.
A lot of stuff on the website. There's a lot of information that the patients can glean from the websites. But like I said, we're giving away free complimentary consults. We're giving away complimentary cone beam scans just so the patients can get a completely educated answer about what it is that they require. So we urge them, give us a call. They will not regret it.
All right,
They'll be
Dr.
happy.
J, thank you so much.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
Clear aligners, they're hot right now. They even have these
Absolutely.
commercials here in California, and you say that they have them over there where you don't even need a dentist involved, I guess.
Yes.
They just send you these aligners or something like that.
Yes.
But you say that you have your own lab and you can even beat their prices because
Yes.
they're a lot less than Invisalign and orthodontics.
Yes.
So tell me about it.
Exactly. They're doing it's DIY dentistry, DIY aligners, DIY orthodontics. People are taking molds inside their houses and sending it to some third-party company. They don't even know if there's a dentist behind it or there's an orthodontist behind it, and they're getting these trays that are correcting their social sixes. It's correcting only their front 4 to 6 teeth, and they're not realizing how it's affecting their bite. We found a way around this where we actually have a dentist, we actually have a specialist, an orthodontist, who can actually guide your whole treatment. And we're able to beat their prices because we are completely digital in terms of a digital smile design, a digital treatment. We have our own 3D printers, and we do the same treatment at the same price, or even better sometimes.
Okay.
But at the same time, you have an expert standing behind it, making sure that the treatment is done is correct for you and it's going to give you the result that you want, rather than you having to try and mess with it. I mean, you wouldn't do your own heart surgery, would you?
So, so you can have pretty crooked teeth and get straight teeth with these aligners?
Absolutely, yes.
Is it as good as Invisalign?
Absolutely. In fact, I think it's better because now we have an expert in the office looking at the treatment modality that's being provided and then making sure that the result is actually what we can.
And it's less expensive than Invisalign?
And it's less expensive than Invisalign.
And a lot less than orthodontics?
It's a lot less than orthodontics. Now, don't get me wrong, orthodontics does have its place. You know, if you need braces, if you need traditional braces, or if you want to go the new clear braces, you know, we can do that as well. We have the gentleman, the specialist, right in our office who can provide you the treatment. But if you are looking for clear aligners at a fraction of the cost, and trust me, you do not want to do this on your own at home. You know, you see those ads, right? Do not try this at home. Please do not try this at home. There's a reason that we're studying for this. There is a reason that there are dentists and specialists who've had special training to do this. Let us do the work for you because it's no more expensive than what you would be paying.
Cosmetic dentistry, smile makeovers. Who's the typical patient, and how does somebody know what their teeth are going to look like when it's all done?
The typical patient is somebody who wants a better smile. Okay. Veneers don't have a lot of contraindications. If you are unhappy with your smile, if you feel like your smile is holding you back, if you're not happy with the color, the shape, the way your teeth are coming together, you know, there's a combination of options with veneers and crowns that we can provide for you to give you the smile that's going to make you happy. With new digital dentistry, we can actually show you a simulation of what your smile is going to look like even before we start the procedure. Okay. You can actually custom design your smile, just like you were custom designing a suit.
And they pick, that's what I want?
You could pick a smile and you could say, okay, I like that shape better. I want my smile to, you could actually say, a gentleman could come in and say, I want the smile that Brad Pitt has. Pick out a movie star you like. If you like their smile, we can give you their smile. It is doable with this day and age. Dentistry has come a long way with digital dentistry, and it's possible. So if you're looking to brighten up your smile instantaneously, you do not have the time for aligners and orthodontics, veneers and crowns provide a very instant makeover for you, a very painless, a very quick makeover, and functionally it gives you the same results that you're going to be happy with for the rest of your life.
Recession. People have cold sensitivity. They don't like the way it looks. Now, you have a new way of taking care of it. You call it the pinhole technique.
That's an amazing.
Tell me about it.
That's an amazing new technique, Randy. Thank you for bringing that up. Cold sensitivity, a lot of people have that, okay? They can't eat ice cream. They can't drink cold water. If it's a cold winter day outside, they can't even breathe the air. It is so debilitating, right? So there's two ways to treat it now. In the olden days, we would take a piece of tissue from the roof of your mouth, you'd put it on the area where the gums receded, and you'd sew it on there. Now, you got 2 areas of surgery. Very painful, okay? You're really in discomfort.
And that's how it's done, like even today?
It's
almost every time.
There's a lot of practice that still do it the same way. Okay? But the recovery is debilitating. It's a lot of discomfort you got to go through. You know, you're popping pain pills like crazy, you know? But now with the pinhole treatment, what is it? The pinhole treatment, think of your gum, Randy, like a curtain, okay? If your teeth are, people don't like it, right? People have these teeth that look like fangs because they're just so long, the gum's fallen away. Think of your gums like a curtain, and if you could just lift them up and pull them down. We always knew we could do this.
Pull them down.
Pull them down. Very gently, very safely, very comfortably. The problem was we didn't know how to anchor it down, okay? Newer technology gives us the ability with some soft tissue grafting that we can actually anchor the curtain. So we pull on the top jaw, we pull the curtain down. On the bottom, we lift the gum up and we anchor it. And there's no stitching, there's no cutting, there's minimal amount of post-operative discomfort. It actually looks better right away after surgery. You could actually, I had this one patient that came in and he had a big meeting coming up in 3 weeks. And he was very, very shy about his front 2 teeth. He did not want to smile, you know, and we did the pinhole for him. Immediately after surgery, he's done.
How soon does a cold sensitivity go away if everything works out?
Instantaneously.
Really?
It's gone because the part of the root that's sensitive to the cold air, the ice cream, the cold water, it's covered.
Can you lose the toothpaste? Like you don't need the sensitive toothpaste
completely
anymore?
Lose the toothpaste. Don't need it anymore. Don't need any stitches. Don't need any kind of severe pain meds to cover you for the discomfort that you're having. You know, they actually call it the lunchtime gum lift. You come in for an hour, you get the treatment done, and you walk out after treatment, and it already
It's
looks
done.
100% better. Cold sensitivity is gone right away, and the recovery time is almost none. It's awesome. It's the best way to go. If you have receding gums, there is no need to hide that smile anymore. There's no need to go through the painful procedures like in the past. Go for the pinhole. Seriously consider the pinhole, because it's
Pinhole technique.
the pinhole
You do
technique.
a lot of dental implants in your office, and you have one of these centers. I guess how it's normally done is you go to one place that does the implant, another place that puts the teeth on top, and you do it all right there.
Absolutely.
Is that
yes,
right?
We do. Yes,
and
we
you
do.
even have your own lab.
Yes, we do.
Okay. Now, if somebody goes to you, they're either wearing a denture or you can't save their teeth, a full mouth of extractions. Okay.
Yes.
What are their options when it comes to dental implants at your center?
Dental implants really opens the door to a whole range of possibilities for these patients, which is wonderful. I mean, you can start with the lower. You can get 2 implants and a denture that snaps in and snaps out.
Okay.
Okay, locks in real nice and solid. You can eat whatever you like. Or you can add a couple more implants. You can add 2 more in the back. 4 implants. It's like a chair with 4 legs. Very solid. It's not going anywhere. You can eat steak with it. You can bite into an apple right away.
No more adhesive or anything like that?
No more adhesive. If you're wearing a denture and you have 4 implants and they lock in and lock out, or they snap in, snap out, whatever you want to call it, you can get rid of the palate, the plastic. You're drinking wine
For the upper.
for the upper or the lower.
Okay.
It works great. It works wonderfully, because these patients are just shocked that I can take the palate out immediately on their own denture. They come in with their own denture that they've worn for 10, 5, God knows how many years. And then I put 2 or 4 implants and I turn it into a snap in, snap out. I get rid of the palate.
Is that right? Okay.
And they're having hot soup. Okay. All of a sudden they realize, wait a minute, this soup is oversalted.
They can taste things again.
You know why? Because they can taste things again. Yes, the palate
Okay.
was preventing them from tasting. They're drinking wine and the wine tastes so much better. Okay? They're eating a toast, and the toast, the paninis, they're amazed at what they've been missing with their food. With the snap-in, snap-out dentures,
Okay.
there's some maintenance involved. Okay? You need an adjustment every 6 months to a year. Okay? Sometimes there's gaskets that lock onto the implants that need replacements. Sometimes the denture needs to be relined.
So there is some maintenance to the snap in, snap out.
There is some maintenance to there.
Okay.
And so you have to be aware of that going in. So the next level up would be a brand new set of teeth that don't come out. I call them teeth. In fact, I call them better than your own teeth, because they don't get
Okay.
cavities.
All right.
They don't need deep cleanings. They don't need flossing and all that. You just come in every 3 months. I do tell my patients, when you get teeth that don't come out, I tell them, listen, you're getting the Cadillac of all options. They're going to serve you. They're going to feel better than your own teeth ever felt to you. You just got to maintain them. So yes, you do have to come in a little bit more frequently
So
for
do you
maintenance.
like a 6 implants on the
6
lower,
implants, yeah.
a full arch of teeth, and they're locked in.
They're locked in. They never need to come out. And you can live your life like you've never lost your teeth again.
And on the upper,
And on the upper.
Same thing?
Absolutely. Same exact thing.
and the roof of the mouth is not covered.
Not covered. Done in one day, Randy, under one roof.
How soon can you eat? Okay, so person comes in, no teeth, and you told me this. They can walk in on the day of the actual procedure.
Yes.
Walk in with no teeth, walk out with upper and lower teeth that don't come out.
That don't come out.
Is that possible?
Absolutely.
Does it happen?
Absolutely. We
Okay.
do it all day, every day. And it's amazing, because once they go home, I mean, of course, there's a little bit of, some preoperative planning has to go in. I mean, when you're talking about fixed teeth that don't come out, there's some planning stages. It's kind of like any kind of.
Like a few appointments before it starts.
Yes,
Okay.
because we're fully guided. We're doing it. What
does that mean, guided?
Guided means we take some scans of your smile. We take a scan of your face. We take some pictures, and that's where I was telling you before is where we design your smile the way you want it. I had this one lady come in. Okay, she told me that she really loved her smile when she was 18 years old. Okay. Can you believe that? And she brought me her photographs from when she was 18, and she's showing me the photographs, and she says, "I want my old smile back." And we gave her her old smile back, and that's possible with digital dentistry. We are experts in digital dentistry, or we like to think we're experts in digital dentistry. I'll say that, but we're able to do that where we can actually show her a simulation of her smile and show her her photograph from when she was 18 and say, "Okay, do you like it?" we've done what you've asked, and she's
So
amazing.
no more dentures.
No more dentures. No more dentures. No more dentures that need to come out, that need to go into a glass of water at the end of the day, that need to be hidden from your spouse, or that you need to run away from a restaurant table just so you can clean it out. You know, bad breath is associated with dentures. You know,
How old can you be to get this brand new set of teeth supported by dental implants?
Age isn't a barrier, Randy. I mean, if you think about it, you know, people. My patient, I just finished rehabilitating an 89-year-old.
Okay.
She's 89, and all she wanted for her 89th birthday was her teeth back. She wanted her teeth back, and she wanted a celebration with all her family, all her kids, her grandkids,
Nice.
her great grandkids, and they had a big cake for her, and she's smiling and eating the cake without any hesitation because she's not worried. You know, you want to blow out the candles on the cake, not blow out your dentures while trying to blow out the candles.
So no more dentures.
No more dentures.
So the implant surgery is not more, they're not more likely to fall out if you're 90 than if
No,
you're in your
not at all.
40s or 50s?
Of course, the cases might be a little bit more difficult. There may be certain considerations that have to be taken into while planning the surgery, because as
You'll work with their doctor and things like that.
we have a group of specialists that we work with. We have an anesthesiologist that we work with. So safety is big in our practice. The reason I have the anesthesiologist is because when we're doing these procedures on people, be it 25, be it 55, be it 80 years old, I want to devote 100% of my time to my patients that I'm trying to rehabilitate. I don't want to worry about them. I'm not worried about managing their heart rate, their blood pressure, their breathing. You know, so I have a dedicated anesthesiologist
On all these cases.
on all
Okay.
of these cases. They're focused on making sure the patient is fine, so that when I'm done with my procedure and the patient wakes up, a lot of times these patients don't even remember. They go home and they're like, "Oh, I forgot my appointment." No, they don't even remember that the work was done, that they already have their new smile. It's unbelievable. It's
So you
fantastic.
say husbands, wives are doing it together? I mean, I think
Absolutely.
you showed me a photo earlier.
Of two lovebirds,
The wife
yes.
does it
High school
first,
sweethearts.
and then the husband comes in.
She loved it so much, and he was so impressed.
And their only option was dentures.
Yes,
And you gave them their teeth back.
I gave them their teeth back.
Is that what everybody wants? Like teeth that don't come out? Because I know you do the snap in, snap out.
Yes,
But if they spend a little bit more, they get permanent teeth that don't come out.
permanent teeth that don't need to come out. I mean, that is the best way to go, Randy. I mean, imagine ourselves, if I lose a tooth, or if I lose multiple teeth, would you want to wear a set that goes in and out? Wouldn't that cramp
That's a good
your
point.
lifestyle?
No.
You know, people are more and more active in this day and age. People are going skydiving. People are going, you know, bungee jumping. You know, they're doing all of these activities, and more power to them. They have the energy to do it. You know, when you're 40,000 feet in the air jumping out of a plane, you don't want to worry about your dentures flying out with you. You want a set that is fixed, that is worry-free, and that lets you do what you want to do, lets you be who you want to be, you know, and not be that person who's always worried about, what am I going to eat next? How am I going to eat at this party? I don't want to go to the restaurant. You know, people go out at any age. Like I said, age is not a barrier, because I have a lot of these patients in their 70s and 80s, and they're playing bocce, they're playing pickleball with their friends. And then after the game, the friends are all going to a restaurant, okay, or they're going to a bar, and you're making excuses. You know, you're like, oh, I got to water the plants, or I got to walk the dog. No, you don't.
Because you don't want to eat in front of
You
your friends.
don't want to eat in front of your friends. You know, so you make an excuse so you can go home and eat mashed potatoes. No, no more dentures. No, fixed teeth liberates you to go out and have fun with your friends, to enjoy your time with your family and your kids and grandkids, and eat what you want to eat without it. You're not looking at a menu
But
anymore.
can you eat, like, let's say, a carrot with your front teeth, or do you have to be careful?
Absolutely.
You can eat whatever you want.
Eat whatever you want.
Like
Eat
nuts?
a steak, nuts, almonds, pistachios. Okay, I don't know, walnuts.
Do they tell you
cucumbers.
eating stories? Did they say, Doc? I mean,
All the time. The lady the lovebirds that I spoke about earlier.
Husband and wife, okay.
Husband and wife team. You know, her desire was to eat a salad with some cranberries and nuts in it, and she can do that. And that is just liberating for her. She's like, okay, you know, I can eat what I want to eat. And the husband, he wants to eat steak. And he actually did right after the surgery. Of course, he cut it up into small pieces. I tell all my patients,
take it easy at first.
take it easy at first. You know, you got to learn to crawl before you walk and walk before you run. Okay, don't go out and go crazy on everything just because you have your fixed teeth right after surgery. But yes, there's a learning curve to it. You have your new smile back. You got to realize, Randy, these people haven't had their teeth in years, 7, 8, 10, and now all of a sudden you give them their teeth back. There is going to be some adjusting to it. They're going to need some adjustment. They're going to need to get used to the new bite, to get used to the new smile. Muscle memory is different when people are using cutlery. So I tell patients, listen, take it easy. They're not going anywhere. They're your teeth. They're not coming out.
So no more dentures.
No more dentures.
Big on sedation dentistry in your
Yes, we are.
practice. So what are the different procedures that this is used for?
Oh, there's a whole range of procedures that you can use sedation for, Randy. You could use it as simple as nitrous oxide, okay? Laughing gas, as everybody knows it. It just relaxes you, makes you calm, relaxed, comfortable, gets the procedure done really easily.
I've told all my friends to do it.
Yeah,
I love
absolutely.
it, by the way.
I love it. Yeah, it's great. It's a great option. Now, a level higher up from would be an oral conscious sedation. We give you a pill, okay? Again, loosens you up a little bit more. You're relaxed. You're comfortable, and you don't even realize how much time has gone. The next level up from that would be IV sedation, where we have an anesthesiologist who's dedicated to monitoring your health while you're being sedated, and then
You do this on most of your procedures, right? Almost all of your implant procedures.
All of my implant procedures are sedated these days. There's a reason for that, Randy, because the patient is comfortable. The patient doesn't have to worry about hearing the noise, about being awake and actually feeling every little bit, okay, of what's going on. They just wake up and they're done. The procedure's complete. There's a lot of people who are candidates for this. I mean, there's a dental phobic patients. Okay, they're just so afraid of coming into the dentist, and this is wonderful for them because they come in. Okay, we give them a pill the night before they come in. They're relaxed. We sedate them, and they wake up and they're done.
Okay.
And the second group of patients that are really good candidates are the type A, the business leaders of the community. They're the movers and shakers. Also the moms in the community. If you have 3, 4, 5 kids and you really don't have time to run back and forth between all the kids' activities and the after-school activities and the sports, to come in for 10 different visits to the dentist to get your treatment done. You come in one day, you're here for 5, 6 hours, you're sedated, you wake up, and you get 6 months to a year of dentistry done in one visit. And it's all done. And it's over. And sometimes they wake up and they don't even have the memory of it. It's beautiful. They're done. They're happy, and they can move on with their lives. And it's safe. It's very safe. We have a dedicated anesthesiologist who's dedicated to making sure the patient is sedated safely and comfortably, while I give 100% of my dedication to making sure that the dental procedures are done. Okay, and it's just beautiful. It works out that way. It is, once you've been sedated, Randy, you never want to get it done any other way.
Because people hate going to the dentist just because of the sound and the uncomfortable, and you're holding your mouth open.
Absolutely,
it's the way to go.
It's the way to go.
You're missing one tooth. Why a dental implant over a traditional bridge?
Traditional bridge, we do that all the time. It was one of the original options that are out there. It's been done since 2,000 years. Okay, ancient Mesopotamians have been doing bridges. They tied gold wire and put an ivory tooth in there. I mean, it's old technology. Can it be done? Yes. Is it an option? Absolutely, it's an option. But what I say is, when you get a bridge, okay, you got to shave 2 other teeth down. So I replace 1 tooth, and I have to drill 2 other teeth. Okay, now, cleaning bridges, you can't floss the bridge, so you got to go underneath the bridge. So you're jumping over hoops just to keep the bridge clean. And what happens when a bridge gets decay? Now the 2 supporting teeth are going to start to rot. And now you got a 3-tooth problem. Okay, so if you get an option to replace a missing tooth with a bridge or an implant, I strongly suggest looking at the implant, because you replace the missing tooth with 1 implant and you're done. It's standing on its own feet. You don't have to drill other teeth. Okay, they're in good shape. You don't have to touch them. The tooth replace on its own feet. That's what I tell everybody. You should seriously consider the implant option.
What about cost?
Cost, I'm telling you, Randy, cost-wise, the implant is always cheaper in the long run. It is always cheaper, because guess what? If the bridge does get decay under it, you're going to look at a 3-tooth problem. Now you got to get 2 or 3 implants to replace that. And it's just, listen, everybody who's wearing dentures, everybody who's wearing partials, it started with 1 tooth. Okay, then it went to 3 teeth, and now it's just snowballs into a full mouth of dentures. If you had stopped that problem, nip it in the bud, put 1 implant in there, and just have a bite that's balanced, so the other teeth are not shifting, top tooth's not coming down. It just makes a lot more sense.
And so, the only reason why everybody doesn't do it, because logically, what you're telling me makes sense. So are they hear the word surgery and they say no thanks?
Yes. A lot of the times they're afraid of the surgery.
But it doesn't really hurt, right?
It does not hurt. I have done implants in my own family. My mom has an implant. Okay, my uncle, I've done multiple implants on them. Okay, it is easier than getting a tooth pulled. People take usually some over-the-counter pain medication for, I mean, of course, they have to take some antibiotics, but you know, as far as pain is concerned, the next day they're back at work. They're back at work, they're functioning fine, they can eat on that side where the implant was placed right away. In some instances, I would say, if you've lost a front, let me tell you this story. Really nice lady, lost a front tooth, just snapped off right at the gum line. She'd had a root canal done years ago, and she had a crown on it, and she bit into lettuce. Can you believe that? Lettuce, and the whole tooth just snapped off at the gum line. She comes in, she's in the people business, okay? She's meeting people, she's in meetings all day, she's talking to new clients. She needs a tooth there. She came in, we took the broken tooth out right away, we placed an implant, and we gave her a tooth on top of the implant the same day. This is game changing in terms of.
So this is the way to go. If you're missing one tooth, always get an implant.
Always consider an implant as the first option to go. I mean, there might be times when maybe the implant's not a right solution, but I feel if you with the right training like what we have, with the right amount of data, the diagnostic data that we're collecting, we can always find a way to get you the implant.
Treat sleep apnea
Yes,
in
we
your
do.
practice without using these CPAP devices. And as you say, CPAP works.
Yes, CPAP does work. But what I tell my patients is to consider alternative options. Now, CPAP has been, sleep apnea is the silent disease of our generation. Okay, it's a lot of people are affected. Some of them don't even know about it. Okay, they think that they're sleeping. They're chronic snorers. Okay, sometimes couples are not even sleeping in the same room.
Okay.
Because of the noise, okay, of the CPAP machine, okay, or the snoring, okay. These people are not getting enough rest. There's research proves that about 60% of sleep apnea wearers who have a CPAP, they don't even use the CPAP machine.
They can't wear it.
They can't. It's non-compliant. They don't like it. They don't wear it.
Okay.
I had a patient who told me he puts his machine on and his wife jokes because he looks like Darth Vader.
Okay.
Okay. It's uncomfortable. It just wasn't working out for him. So we have an alternative where we make a custom-made device that pulls the jaw forward, opens up the airway, and all of a sudden you're breathing a lot better. Okay, no more CPAP. You can get rid of the machine. You're getting the same amount of oxygen. You're not a zombie anymore. You're not walking around all tired all day long. You're not cranky because you're getting rest.
Is this true? I mean, people with sleep apnea, they think they're sleeping, but they're not sleeping.
They're actually not sleeping. We have studies that show that sometimes people with sleep apnea, they actually stop breathing for more than a minute. More than a minute, Randy. You're not breathing for more than a minute. That is dangerous. That's the leading cause of stroke, heart disease. You know,
Okay.
a bevy of other diseases that are like silently creeping up on you. Okay, and you're not even aware of it. Okay, and a simple mouthpiece that opens up the airway can fix all of those problems.
And they're sleeping again.
And they're sleeping again. They're getting the rest. They're waking
they're
up
back in the
cheerful.
same room.
They're back in the same room. They're together. They're a couple again.
So who likes it the most? The
I think the
partner?
wife. I think the partners like it the most.
So the chronic snoring also?
The chronic snoring
You can
also,
work with
yes,
that too?
Absolutely. That is a sign that you've got sleep apnea. If you're a chronic snorer, you got to get a sleep study done right away and figure out what your blockage is. How much are you breathing and how much are you actually not breathing per night? Because that is an eye-opening number, Randy. When you look at that number and realize that, oh my God, I'm not breathing for a minute or two every night, you know, every
Like
10 or
every
15
hour,
minutes.
maybe?
Every hour, they stop breathing. They're literally dead on the bed for a minute or two every hour. And that is scary, Randy. That is
So that's
scary.
why they wake up exhausted.
That's why they wake
So
up
do you have
exhausted.
patients that you make them this custom-made appliance and they wake up and they have more energy?
They're more cheerful, they're more happy, they can go about and they just feel a lot more energy throughout the day, you know? They're awake.
Because we all know what it's like not to sleep. You feel
You're
lousy the
tired,
next
you're
day.
lethargic, you can't get any work done, you know? You're not yourself anymore. You know, it's like that Snickers ad.
Okay.
You're not yourself when you're not having your sleep apnea appliance.